Welcome to Velora Nursing. Today I am going to deal about communication skills. Now I go through introduction. Communication. The word communication is originated from Greek word communis, meaning to make or to make common. Okay, means that communication word is derived from the Greek word communis. Communis means what? To make common. Then communication means what? It is one of the fundamental aspect. For everyone, the communication is most important. It may be verbal communication or the non-verbal communication, whatever it is. But the communication is most important. Why it is important means to establish, to maintain and to improve the relationship with the other people. This communication is most important. Okay. I hope you understood the introduction regarding the communication. Okay. Next I go through definition of the communication. Communication means what? It refers to giving and receiving of information, ideas, facts, opinions, beliefs, feelings and attitudes through a verbal or non-verbal means between the people. Means it is a process of giving information. Means it may be the person is giving information to the other people, then the person is getting information or receiving the information from the other peoples. Okay, any information, it may be ideas regarding anything, or it may be facts regarding anything, or it may be other people's opinion or beliefs, it may be feelings or any attitudes. Okay, with the other people we are getting information or we are giving some information to the others also. That is called as communication. The way of communication depends on every individual. Okay, understood? Hope you are understanding this definition of the communication. Next I go through types of communication. First type, verbal communication. Second type, non-verbal communication. Verbal communication means it takes place through a spoken or written words. Means it's through verbal communication we are going to maintain it through the oral communication. Means through spoken or it may be written words. Okay, this is called as verbal communication. Then non-verbal communication means without its opposite to the verbal communication. In the verbal we are going to speak by using oral communication we are going to use, but non-verbal there is no we are using what? Oral communication, or it may be in this we are going to show some gestures or any behavior that do not involve spoken or written words. Means we are going to give some facial expressions, then we are giving what? Physical activities or physical appearance we are going to show, then we are going to show some gestures. Okay, this is called as non-verbal communication. Means simply you can understand, verbal communication means through the oral or through the spoken we are going to use. Non-verbal means opposite to that. It may be any expression, it may be facial expression or it may be physical appearance or showing some gestures to the other people. These are all the types of what? Communication. Now I am going through communication process. First, mainly three processes there. First one, sender, then message, then receiver. Sender means one who sending the message to the other people. Means teacher and student. I take this as an example. Teacher is the sender here. Then some messages is there. Students are the receivers or the listeners. Okay, sender means teacher is sending some message. After encoding the things, the teacher is sending the messages to the children. The way of listening or decoding is different. Okay, not every students are listening in the same by putting same capacity. Okay, according to their convenience they can decode the information, then they will get the information. After getting some information or the message, students is going to give some feedback to the sender who is sending the message. For them they are going to give some feedback. This is the communication process. Then key components for establishing communication with the patient. First one, open discussion. means we have to allot all the patients in one place, then we have to start to discuss openly regarding their problem or regarding hospitalization or something. Openly we have to discuss without any confidentiality. We have to communicate openly with the patient. Then we have to gather all the information, means which problem they are suffering, everything we have to collect. We have to gather all the information from the patient, then try to understand the patient perspective, means their idea also we have to collect, means we have to try to understand the patient's perspective. Then comprehend information and explain it. Comprehend means like a complex information we have to explain to the patient. Okay, then we have to share some information to the patient regarding their problem or something. Then we have to get an agreement on the problems. According to the problem we have to make some plans. Then we have to be a listener, means we have to able to be a listener of the patient, means if the patient saying something, means we have to listen all those things without any judging. Okay, this is regarding key components of communication. Now I am going through importance of good communication in the nursing. Okay, first importance, it generates trust between nurse and patient, means if we communicate with the patient nicely, means that time only we can get what trust between the patient and the nurse. Yes or no? That communication is helps in the between trust between the nurses and the patient, that will helps. Okay, then it provides professional satisfaction and improve the patient well-being. This good communication will helps the to maintain satisfaction in between both the patient and the what nurse. Okay, then that will helps to improve the patient well-being. This is the second use or second important things to maintain good communication. Next, it helps to promote the managerial skills and provides a basis for leadership action, means that will helps to manage or that will helps to promote the some managing skills in the both what where patient and also the nurse. Then it will essential element in patient safety and quality of hospital care. Good communication will helps in the patient and also to maintain a safety in the patient, that is very useful. This is regarding importance of the good communication.